It's been a rough past few years for American teenagers. They've navigated a major pandemic along with the usual challenges of growing up.
I feel like after the pandemic hit, it was really hard for a lot of people who were in school, who are used to these routines, to just go abruptly to being at home.
18-year-old
Especially, like,
Leah
friends.
Wilson says that social isolation compounded anxieties many kids were feeling already.
I have several friends who fell into month-long states of depression and had to get like treatment because it was getting really bad for them to be alone with their own thoughts for long periods of time.
I think it's our number one health issue in the country right now.
Dr. Stephen Berkowitz with the University of Colorado School of Medicine says the mental health of teenagers is a major cause for concern.
A lot of anxiety disorders, a lot of depression.
Eating disorders are up, he says. Kids are a frequent sight in hospital emergency departments.
We're seeing it in droves.
Most alarmingly, youth suicides are up in a number of U.S. states. Last fall, 3 health organizations declared a national emergency for child and adolescent mental health. Berkowitz says it's not a new phenomenon, that issues like climate change and social unrest, not to mention tensions at home, were stressors already.
You add all these things, the cumulative nature of all this, and so you get COVID, and you get a pandemic, and all those issues that were bubbling are, now spewing.
He believes the country has been far too reactive, that a lack of things like child tax credits and adequate mental health services make it hard to build resilient families.
The biggest problem, I think, is sustaining treatment and interventions and support. We talk all the time about, the need to support families, and, families are this and parents should be doing that, and we give them no opportunities to really do that.
Some steps are being taken. Colorado children can now access free mental health counseling. Stress management apps are increasingly available too.
There's a lot of resources at my school, and they care a lot about our wellness and mental health. So they give us days to take breaks and not have classes. I was struggling a lot with like anxiety and also sort of depression, just like feeling like I have to be perfect and stuff.
Leah's 16-year-old sister Milani says her school prioritized mental health when the school year first started.
Third and fourth quarter was like none of that. It was just like work, work, work.
The pressure she felt has lifted, but for many her age, the struggle to cope with this complex world during these difficult times continues. Hendrik, Sybrandy, CGTN, Denver.